organized by the National Human Rights Commission, NHRC India. We have among ourselves the gracious presence of Dr. Bharti Praveen Pawar, Honorable Minister of State for Health and Family Welfare as a chief guest, Mr. Justice Arun Mishra, Honorable Chairperson, National Human Rights Commission, Dr. Gyaneshwar M. Mule, and Mr. Rajiv Jain, Honorable Members, Mr. Justice M. Kumar, former member at NHRC, Secretary General Mr. Bharat Lal, National Human Rights Commission, and Mr. Sudhansh Pant, official on special duty and Secretary Designate, Ministry of Health and Family Welfare. Shubham karoti kalyanam arogyam sukh sampadam mam buddhi prakasham cha deep jyotir namo astute. दीप ज्योति शुभ करे, कल्याण करे, आरोग्य करे, सुख संपदा प्रदान करे। आइए कार्यक्रम का शुभारंभ इसी भावना के साथ दीप प्रज्वलन करने के साथ ही आरंभ करते हैं। मैं रिक्वेस्ट द डिग्निटरीज to please take their seats on the dais to begin with the proceedings of this conference. Dr. Bharti Praveen Pawar, Honorable Minister of State for Health and Family Welfare. As the Chief Guest, Mr. Justice Arun Mishra, Honorable Chairperson, National Human Rights Commission, Dr. Gyaneshwar M. Mule, and Mr. Rajiv Jain, Honorable Members, and Mr. Justice M. Kumar, former member NHRC, Secretary General Mr. Bharat Lal, and Mr. Sudhansh Pant, official on special duty and Secretary Designate, Ministry of Health and Family Welfare. May I request Secretary General NHRC to please welcome Dr. Bharti Praveen Pawar, Honorable Minister of State for Health and Family Welfare, and the chief guest by presenting a planter. May I also request Mr. Lal to please welcome Mr. Justice Arun Mishra with a planter. Thank you, sir. May I now request Mr. Devendra Kumar Nim, Joint Secretary NHRC, to please welcome Dr. Gyaneshwar M. Mule, Honorable Member NHRC, with the planter. May I request the Joint Secretary to also welcome Mr. Rajiv Jain, Honorable Member NHRC, with the planter. Mr. Nim is requested to present a planter to former member NHRC, Mr. Justice M. Kumar. May I also request Mr. Nim to welcome Mr. Sudhansh Pant, official on special duty and Secretary Designate. Okay. Thank you, sir. May I request Mr. Nim to present a planter to Secretary General, NHRC, Mr. Bharat Lal. Thank you. May I now request Mr. Bharat Lal, Secretary General, NHRC, to deliver welcome address and give an overview of this conference.
Good morning to you all. Chief guest, Honorable Union Minister of State for Health and Family Welfare, Dr. Bharti Praveen Pawar, Honorable Chairperson, National Human Rights Commission, Mr. Justice Arun Mishra, Honorable Members, Mr. Gyaneshwar Mule, Shri Rajiv Jain Sahab, and former member, National Human Rights Commission, Sri Justice M.M. Kumar, distinguished delegates, experts from mental health institutions, senior officers from Government of India and states, and ladies and gentlemen. And more importantly, I also welcome the people who have joined online from throughout the country. Indeed, it's a privilege for me to stand here and extend welcome on behalf of National Human Rights Commission to this national conference, Moving Mental Health Beyond Institution 2023. I think importance of the conference you know better than me. As we all know, mental health issues is one of the most critical health issues of our times. At the outset, on behalf of the Commission, I extend a warm welcome to Honorable Minister, who has joined this conference despite parliamentary session. As we all know that we have dealt with parliamentary issues, that at this point of time, sparing 1 hour here, I think it's a very big. Thank you, ma'am, for being here, and that shows you as well. Well, friends, as we all know, Justice Arun Mishra, Honorable Chairperson, National Human Rights Commission, he has given a new direction to the Commission, and his compassion, his empathy, and taking up these issues, I think is quite remarkable. I am here since last 20-odd days, and I have seen the kind of leadership he provides. And I think on behalf of Commission, we are grateful to have a chairperson like him. Sir, I take liberty to welcome you because you are the host, and this has been organized at your behest, at your initiative. As we know, Dr. Dhaneshwar Mule Saab, he has been an esteemed colleague, and he has done throughout life wonderful work in foreign service as a diplomat and here in the Commission. Similarly, Mr. Rajiv Jain, we all know, honorable member, both have been guiding force, in fact. And let me share here that the presence of such august member in the Commission, it gives a special character to the Commission. Their sensitivity, their guidance, and their support, I think we are learning a lot, and whatever we are doing is because of their presence. Sir, welcome to both of you in your own conference. I also welcome former member, National Human Rights Commission, and former Chief Justice, Jammu and Kashmir High Court, Justice M.M. Kumar. In fact, let me share that both the book which we are going to release, Honorable Minister is going to release, and report, and the whole this exercise has been done at his behest. Sir, we are very grateful to you for your guidance and welcome to this gathering. Due to some sudden development, my esteemed colleague, Mr. Sudhans Pant, who is going to take over as Secretary Health from 1st of August, he could not join, and he has other officers from ministry who are here. On behalf of the Commission, we welcome all of you, especially the professionals and officers from state government and mental health institutions. So thank you all for being here. Let me give just a small overview of this conference, actually. As you know that Government of India has taken a number of initiatives over the last couple of decades, especially National Mental Health Program 1982, District Mental Health Program, and then Manpower Development Scheme for establishment of centers of excellence, and establishing postgraduate departments in mental health specialists. And of course, as we all know that Mental Health Care Act 2017 is a landmark, and that has started this journey. National Human Rights Commission has been playing an important role in assuring and promoting awareness on mental health among various stakeholders, especially state and UT governments. The Commission has also taken initiative to understand the grassroots level issues affecting the implementation of Mental Health Care Act 2017. As we all know that way back in 1997, Honorable Supreme Court, in fact, it mandated National Human Rights Commission to be involved in the supervision of functioning of mental health institutions, especially at Agra, Gwalior, and Ranchi. In 2002, 22, Honorable Chairperson, gave a new impetus to the mental health issues. He requested the Chief Justices of Allahabad, Jharkhand and Madhya Pradesh High Court to monitor the functioning of the mental health institutions, hospitals and arranged to send quarterly reports to the Commission. The Commission headed by Justice Sri Arun Mishra along with members and senior officials visited all four of these institutions personally to have first-hand knowledge of the condition and functioning of these institutions. Thereafter, Commission requested our special rapporteurs to visit and collect information of the government mental health care established throughout the country and give a report, recommendation, and to remove its shortcomings. Commission also held various workshops in each institution to discuss key challenges and issues and formulate a plan for their efficient function. Sir, after detailed analysis, the Commission issued notices across the country calling for detailed action taken reports. The Commission has prepared a report as well as a book to further enhance the understanding of mental health and the shortcomings and issues related to implementation of Mental Health Care Act in the country. The book, which today Honorable Minister is going to release, the book Mental Health Concern for All, in context of Mental Health Care Act 2017 and the status report. The status of implementation of Mental Health Care Act 2017 has been prepared. Due to time constraint, I am not discussing the content of these two reports, the book and report, and I will request you to kindly read, kindly go through, and I think from here we'll take it forward. Well, the idea of organizing this conference started in 2022 to create an environment for better health, mental health condition. In this period, the Commission has been monitoring various mental health institutions in the country. As you know, mental health is an integral part of health. It is more than absence of mental illness. It is the foundation for well-being and effective functioning of individuals. It includes mental well-being, prevention of mental disorders, treatment and rehabilitation. In this endeavor, the union and state governments, mental health institutions and experts are partners. Moving beyond institution, encourage early intervention and prevention strategies. By providing accessible and proactive community-based care, we can identify mental health concerns early and intervene before they escalate. The most important part continued working with people to enhance their understanding of mental health issues. Today, experts, researchers, practitioners, and advocates from various fields related to mental health are assembled here. They'll share their insights, research findings, and best practices, fostering a better understanding of mental health challenges and potential solutions. I'm sure that this conference on mental health will provide an excellent platform to raise awareness about mental health issues, breaking the stigma surrounding the mental illness. Once again, on behalf of the Commission, I welcome you all to this conference and have a meaningful day. Thank you very much.
Thank you, sir. Mr. Justice Arun Mishra, Honorable Chairperson, National Human Rights Commission, has been having a lot of concern for human rights, both as a judge in the High Courts and the Supreme Court, and now as the Honorable Chairperson of the National Human Rights Commission. Besides addressing the concerns on various issues of human rights, he has made concerted efforts to address the challenges being faced by the mental health care system in the country. He, along with the honorable members and senior officers of the Commission, not only visited the mental health care institutions in Gwalior, Agra and Ranchi, but also ensured that the Commission, through its special rapporteurs, visited all the 47 mental health care institutions in the country to have a first-hand account of the challenges and way out for their resolution through this national conference. May I now request Mr. Justice Arun Mishra, Honorable Chairperson, NHRC, to please deliver the keynote address.
Honorable Minister of State for Health and Family Welfare, Dr. Bharti Praveen Pawar, my esteemed colleague, Mule Saab, Jain Saab, former member Justice M.M. Kumar, Secretary General Shri Bharat Lal Ji, my other esteemed colleagues, Dr. Mahajan, member of the core group, officers of the central and state government, experts of the mental health institutions, persons from media, civil society, distinguished invitees, ladies and gentlemen. We have gathered here. It is a crucial moment in our collective efforts to address one of the most pressing issues of our time, mental health. It affects everyone, regardless of background, profession, or socio-economic status. It is an issue that knows no boundaries and demands our unwavering attention. I welcome experts, practitioners, other stakeholders from various fields to engage in vital discourse by facilitating an open exchange of knowledge and ideas. Today we find ourselves in an era marked by unprecedented challenges. The fast-paced nature of modern life, coupled with the impact of global events, has taken a toll on our mental health. Stress, anxiety, depression, and other mental health conditions have become all too common, affecting individuals of all ages and backgrounds. 1 out of 10 persons suffer from one or different kind of mental disorder. We face the suicide of approximately 13,000 students every year. Besides, we find suicides in jail, semi-armed forces, armed forces, and others. Abuse of elders and workplace stress is to be cared for. Depression is one of the leading cause of disability. In recent years, there has been increasing acknowledgement of vital role mental health plays in achieving global development goal, as illustrated by its inclusion in the sustainable development goals. We must strive to eliminate mental health stigma, which still prevails in the society with this disease. Encouraging open conversation and foster understanding and compassion is a requirement of the day. We require empathy towards mental illness, not mere simple sympathy. Dignity in mental health, ill health condition is to be protected at all costs. We aim to achieve dignity through the Mental Health Care Act of 2017. 2017 is a human-centric, human rights approach-oriented act which brought paradigm shift in mental health care and aimed at protecting the human rights, and it decriminalized also the suicide attempt. Addressing mental health requires a comprehensive approach encompassing health care, education, public policy, and social support system. We need integration of mental health, substance abuse, general medical care, and hospital and community care, which are poorly coordinated at present. Mental health is to be given the same importance as physical health. Mental hospitals should have a close-knit team of psychiatrists, clinical psychologists, social workers, psychologists, nursing staff. In a welfare state, it is the state's obligation to provide medical facilities to every human. That is imperative by virtue of Article 47 of the Constitution of India. Hospitals should run to perfect standards, promoting quality care with quality rights, providing psychological support and interventions, including digital one, and work for suicide prevention. Without mental health, there is no health. We require to mobilize efforts to raise awareness of mental health issues. We must integrate mental health education into our schools, colleges, and workplaces, setting up of healthy boundaries with social media is also necessitated. The approach to mental health and techniques of psychiatry has changed. Psychologists have innovative tools and methods. The latest research is of blood tests. They determine mood disorder by virtue of RNA biomarkers. Transcranial magnetic stimulation is also being done. Australia and England are pioneers in the field of research work. We need to modernize infrastructure and approaches in mental health establishment. Allocation of resources to update mental health services and research is necessary to make mental health a reality. We face obstacles in implementation of the Act of 2017 due to non-establishment of state mental health authority in some states and mental health review board for a district or a group of districts. Framing of state mental health rules and regulation is still required as prescribed under sections 45, 73, 122 and 123 respectively of the Act. Registration of all hospitals is necessary under section 65 of the Act, which is yet to be achieved. There are limited number of educational institutions and seats for professional mental health courses, leading to a limited number of mental health professionals. We need to increase the MD, MPhil diploma seats. The severe shortage of doctors' staff infringe human rights of mentally ill patients. Most institutions are working with 30 to 40% staff. There is a necessity for a lady psychiatrist or psychologist for female patients. A hospital is not a place where cure patient should be allowed to stay even for a single extra day. The problem restricts the hospital's ability to cater to the needs of new patients who need urgent intervention. In some visits undertaken by the Commission to mental health centers, it was noticed that often the number of patients was higher than the sanctioned strength, and large number of those patients who had already got cured continued to stay in these centers, and medical facilities and hygienic standards were much below acceptable standards. Besides, no serious coordination was visible among the various agencies such as district administration, the police, mental health, court, center officials to health centers, and official to facilitate halfway homes or return of cured patients to their families. We hope there is a better coordination among authorities to streamline procedures and improve this situation. The report indicates that there are approximately more than 2,000 cured patients in the mental hospitals. There should not be even one cured patient in a hospital. Hospital is not a place for a cured patient. But unfortunate situation is that half of them are housed in West Bengal only, in 4 hospitals, more than 900. This is a travesty of justice. We are using these hospitals to keep fit persons who do not require treatment. This situation must be looked into by all of us. I am giving the figures, though I was not proposing to give it earlier. The establishment cannot keep a patient once the patient has fully recovered as per their rights, statutory and constitutional. Statutory right is provided under Section 19(1)(a) and (b) of Mental Health Care Act 2017. It results in the unlawful detention of fully recovered patients as not having a family or not being accepted by the family, or homelessness is not a criteria precedent to the release of the patient. Section 19 says you have to still release them if they are not being accepted by the family. The courts and the police have also to ensure help for union and families as per the mandate of section 100, 101, 102 of the Act. When the court can send them to the mental hospitals under section 100, the power to do an act includes the power to undo it. The Ministry of Social Justice and Empowerment, Government of India issued to state government and union territories guidelines for discharge of mentally cured or fit for discharge patient from mental health institutions and guidelines for state government for setting rehabilitation homes. Central government has also floated a scheme, Deen Dayal Disabled Rehabilitation Scheme, revised guidelines with effect from 1/4/2018, which specifically makes provision for persons who have been successfully treated for mental illness. The project for halfway homes, which the Government of India funds, is aimed at 1. Providing necessary alternatives for the persons who have received the treatment for mental illness but do not require hospitalization. 2. Filling in the vacuums as families and communities still hesitate to accept such persons. 3. Providing vocational training so that such persons can fend for themselves and are otherwise constructively occupied. 4. Ensuring continued access to healthcare facilities if required by the cured patient. 5. Reintegration of such persons with their families by counseling and community at large. For want of implementation of the aforesaid welfare scheme by the takers and by the authorities, we lack halfway homes, rehabilitation and occupational therapy units to house recovered patients. There is need for funds. Hospitals are unable to provide basic amenities to patients, including nutritious food. Calories differ as per the data collected from 1500 to 3300 in various hospitals. Diet is to be managed appropriately. And drinking water, comfortable bedding, even pillows are not provided. Hygiene and fresh clothes, recreation facilities must also be provided. Bad condition of toilet and unhealthy foul smell in the wards creates inhuman situation to live. It is violative of mandate of section 20, suffices to say so. When we can have modern infrastructure in these fields, why we cannot provide the mental hospitals? I fail to understand. There are only 47 mental hospitals in the country. We can do it. Overnight we can do it. We can plan overnight. But I do not know what is the hitch. Lack of proper infrastructure, mental health institutions resemble a lock-up-like situation. Patients are not permitted to go out. Even recovered persons are not permitted to go out. That is a travesty of justice. Where we are. Are we treating them or keeping them in lockup? There needs to be more CCTV surveillance and security personnel to check behavior and effective control of staff and patients. There's dearth of emergency services. Drugs should be kept in-house. We must address the underreporting of events such as adverse effect of medication drug reactions and deaths of patients in violent incidents between patients. There is a lack of digitalization of medical records, which poses a risk of facilitating well-informed communication for future references. The problem of misrepresentation of mental illness by criminals defeats the course of justice and deprive utilizing facilities by genuine patients. I may share one experience. I asked criminal at Ranchi, how long you have been here? 9 months. How long you will be here till I get the bill? I do not know. how to improve the situation. The lack of participation of mental health institution in the district mental health program adversely impacts the assistance that may augment institutional capacity and promote community awareness. A responsible network of civil society organizations and NGOs for intellectually disabled patients and persons suffering with depression should be developed. Large areas and gardens are attached to the hospitals. There is need for sound management of these areas and also prevent the encroachments. Large number of apps are available for mental health guidance. Generally, no national standard for evaluating mental health apps exists. The apps provides anonymity, accent outreach, and ensure services availability and advice 24/7. National mental health program Telemanas also cater to the need. Sensitization of health workers and community at large is necessary. Experts must be provided exposure to international and national level research and new methodologies being adopted. Individuals with sound mental health can contribute positively to their families, workplaces, communities. We are not in a blame game here, but our intent is that situation must improve through joint effort. And we achieve the goal envisaged by the wonderful Human-Centric Act of 2017. That is unparalleled act anywhere in the world, but still there's a distance between cup and the lip. Let us foster interdisciplinary collaboration among healthcare providers, policymakers, researchers and educators and community leaders. By working together, we can develop holistic situation that addresses the multifaceted aspects of mental health, ensuring that no one is left behind and realizing a dream of Sarve Bhavantu Sukhinah, Sarve Santu Niramayah, Sarve Bhadrani Pashyantu, Ma Kashchit Dukh Bhagavit. Jai Hind.
Thank you, sir. The National Human Rights Commission has been publishing books on various issues of human rights, including mental health care, to raise concerns and spread awareness. In the series of such publications, the Commission has published a new book and a report. The book is titled Mental Health, Concern for All in Context of the Mental Health Care Act 2017. The book carries significant aspects of mental health, such as the mental health of children, women, elderly persons, LGBTQIA+ community, prison inmates, among others. It also significantly talks about the mental health policies and laws in India to make it serve the purpose of a reference book. I have the honor to inform that we have among ourselves the august presence of Mr. Justice M.M. Kumar, former member of the NHRC, who tremendously contributed in shaping this book. May I now request Honorable former member, Mr. Justice M.M. Kumar, to please present the book to the Honorable Minister and Chairperson, NHRC, to release it. Thank you, ma'am. Thank you, sir. The Commission has also prepared a comprehensive report on the status of implementation of the Mental Health Care Act 2017. It is an outcome of the visits of the Commission and its special rapporteurs to the mental care hospitals and institutions in Gwalior, Agra and Ranchi, and 47 mental health care institutions in different states of the country. May I request Honourable Minister and the dignitaries on the dais to kindly release the report on the status of implementation of the Mental Health Care Act 2017. Thank you. Dr. Bharti Praveen Pawar, Honorable Minister of State for Health and Family Welfare, is a medical professional and has been active social worker also. She brings along with her the experiences and challenges being faced in the health sector on the ground, both as a medical professional and as a social worker. She has served as a member of a standing committee on health and family welfare and also as a member of consultative committee on Ministry of Skill Development and Entrepreneurship. She joined the Council of Ministers as a Union Minister of State for Health and Family Welfare on 7th July 2021. May I now request Dr. Bharti Praveen Pawar, Honorable Minister of State for Health and Family Welfare, to please deliver her inaugural address.
नमस्कार। आज के इस कार्यक्रम में उपस्थित जस्टिस अरुण मिश्रा जी, श्री भरतलाल जी, जस्टिस कुमार जी, डॉक्टर ज्ञानेश्वर मुले जी, राजीव जैन जी, सभी मान्यवर, मीडिया के प्रमुख, नेशनल ह्यूमन राइट्स कमीशन आयोजित इस कार्यक्रम में मूविंग मेंटल हेल्थ बियॉन्ड इंस्टीट्यूशंस इस विषय पर इस राष्ट्रीय सम्मेलन में आप सभी के बीच उपस्थित होकर मुझे बहुत प्रसन्नता हो रही है कि ये भी कार्यक्रम आयोजित करने में NHRC ने बहुत बड़ी उपलब्धि कराई है। हम उनका सबका अभिनंदन करते हैं। मैं सराहना करती हूं कि नेशनल ह्यूमन राइट्स कमीशन हमेशा से ही मानव अधिकारों की रक्षा, मानव अधिकारों के संबंधित विषय के प्रचार, संरक्षण, उसकी अकाउंटेबिलिटी और ट्रांसपेरेंसी ये सुनिश्चित करने के लिए और राष्ट्र के भीतर मानवीय गरिमा और न्याय, इसके लिए संस्कृति को, हमारी सभ्यता को बढ़ावा देने के लिए महत्वपूर्ण भूमिका आज NHRC निभा रहा है। साथियों, जैसे हम जानते हैं कि मेंटल हेल्थ इज इंटीग्रल पार्ट ऑफ हेल्थ। मेंटल हेल्थ किसी भी व्यक्ति की भलाई और प्रभावी कामकाज की नींव है और इसीलिए हमारी भावनात्मक, हमारी मनोवैज्ञानिक, हमारी सामाजिक भलाई इसी में शामिल है और यह निर्धारित करने में भी मदद करती है कि हम तनाव को कैसे संभालते हैं। जस्टिस मिश्रा जी ने बहुत सारी बातें उठाई जो सोचने विचार करने के लिए जरूरी है कि हम किस तरीके से इस तनाव को संभालते हैं और तनाव को बढ़ने के बाद किस तरीके से मेंटल स्ट्रेस और मेंटल डिसऑर्डर के रूप में एक बड़ा डिसऑर्डर सामने आता है, तब संभालते हैं कि अगर काश इसको पहले ही शुरू में हम कंट्रोल कर पाते। प्राइमरी, सेकेंडरी, टर्शरी केवल नाम नहीं है, ये स्टेप्स है। और आज हमें छोटी छोटी बातों पर, सर मुझे आज भी याद है कि मेरे घर में एक छोटी बेटी आई थी, नर्सरी की एग्जाम थी। सर नर्सरी के बच्चों को भी टेंशन है कि कल मेरा एग्जाम है, मुझे पोएम बोलनी है टीचर के सामने। तो हम किस दिशा में जा रहा है ये भी सोचने वाली बात है कि हम हमारे बच्चों पर क्या इतना स्ट्रेस दे रहे हैं जिनकी उम्र खेलने की है। शायद जस्टिस साहब आप तो यूर लकी कि आपके समय में टेंशन शब्द भी नहीं हुआ होगा, राइट? यहाँ पे जितने सीनियर से तो मैं पूछना चाहूंगी कि शायद टेंशन शब्द मतलब अलग है, यह शब्द ही अलग है, था ही नहीं, उपयोग ही नहीं करते थे। और जो भी देखो, संकट के बिना कोई जीवन नहीं है, समस्या के बिना कोई जीवन नहीं है, और हर समस्या का समाधान है, ये भी तो जीवन है। तो इसे भी हमें समझना चाहिए। भगवान जब समस्या देते हैं तो उसके पहले भगवान समस्याओं का समाधान देते हैं। इसे देखने की ताकत हम सब में है, लेकिन हम शायद उस दृष्टि से देखते नहीं है। तो मुझे लगता है कि ये तनाव को हम किस तरीके से संभालते हैं और दूसरे से कैसे संबंधित होते हैं हम, और हम क्या विकल्प चुनते हैं, इस बात को लेके मानसिक स्वास्थ्य संबंधी सभी हमारी सामाजिक, हमारी आर्थिक, हमारे एज, सेक्स, सभी बियॉन्ड उस स्थितियों की परवाह किए बिना जीवन के सभी क्षेत्र को ये मेंटल स्ट्रेस, मेंटल हेल्थ हमारी प्रभावित करती है। मानसिक बीमारी से प्रभावित अधिकांश लोगों को यह समझने में मुश्किल होती है कि वे इससे पीड़ित है, या फिर वो इस समझने के बाद भी उस इलाज से बचते हैं, क्योंकि मानसिक बीमारी को आज भी समाज अलग दृष्टि से देखता है, अच्छी दृष्टि से नहीं देखता है। और इसीलिए यह महत्वपूर्ण है कि मानसिक बीमारी से प्रभावित लोगों को मदद लेने और उसका उपचार का लाभ उठाने के लिए हमें प्रोत्साहित किया जाना है, उसे प्रोत्साहित करना है, और जिससे हमें मानसिक स्वास्थ्य स्थितियों से सीधे जुड़ी कुछ शारीरिक स्वास्थ्य समस्याओं को भी नियंत्रित करने और उस चुनौतियों को सामना करने में आसानी हो सके। Friends, it is important to mention here that as per the National Mental Health Survey of India conducted through NIMHANS Bengaluru in 2016, the prevalence of mental disorders in adult over the age of 18 years is about 10.6%, which is very, very bad. आदरणीय प्रधानमंत्री जी के नेतृत्व में देश में मानसिक स्वास्थ्य के मुद्दों को समाधान के लिए कुछ उल्लेखनीय कदम उठाए हैं। देश भर में मानसिक स्वास्थ्य की सेवाओं को और उसके लिए बुनियादी ढांचों को विस्तार करने के लिए प्रयास किए गए हैं। प्रधानमंत्री जी के कार्यकाल में मानसिक स्वास्थ्य को एक महत्वपूर्ण सार्वजनिक स्वास्थ्य चिंता के रूप में जाना गया है, अधिक ध्यान दिया गया है, और उसके लिए मिशन मोड पे काम किया जा रहा है। इसमें हमारी मानसिक स्वास्थ्य सुविधाओं की संख्या बढ़ाना हो, हमारे यहाँ ट्रेनर्स हो, डॉक्टर्स हो, उसमें जो एक्सपर्ट्स हो उनके प्रशिक्षण देना हो, मानसिक स्वास्थ्य सेवाओं को प्राथमिक स्वास्थ्य देखभाल में भी उसको शामिल करना हो। प्राइमरी लेवल पे जब गांव-गांव में सुविधा नहीं होती है टर्शरी केयर की, लेकिन प्राइमरी हेल्थ केयर में भी उसका समाधान मिले। 2014 में जब हमारी सरकार सत्ता में आई तो हमने नेशनल मेंटल हेल्थ पॉलिसी पर काम किया, और मेंटल हेल्थ केयर एक्ट 2017 में मानसिक बीमारियों से प्रभावित व्यक्तियों को कानूनी अधिकार प्रदान करने के लिए भारतीय संसद द्वारा पारित एक ऐसा ऐतिहासिक कानून बनाया, और यह मानसिक स्वास्थ्य उपचार और देखभाल के लिए यह कानून जोर देता है, जिसके बारे में आदरणीय जस्टिस साहब ने बोला है। फ्रेंड्स, इन दिस कॉन्फ्रेंस experts shall discuss the challenges in the implementation of Mental Health Care Act 2017, needs to address the infrastructure and human resources aspect of mental health establishments, rights of person with mental illness, including reintegration and rehabilitation and latest trend in critical care of mental health, इंटरनेशनल पर्सपेक्टिव एंड द वे फॉरवर्ड। भारत में मानसिक अस्पताल जरूरतमंद व्यक्तियों को व्यापक मानसिक स्वास्थ्य देखभाल प्रदान करने के लिए संरचनात्मक रूप से तैयार है। इन हॉस्पिटलों की संरचना और कार्यात्मक पहलुओं को हमारे नागरिकों के लिए एक सर्वोत्तम देखभाल सुनिश्चित करनी चाहिए। मानसिक बीमारियों से पीड़ित लोगों के सशक्तिकरण की दिशा में काम करना बहुत ही महत्वपूर्ण है और ये अभी नीड ऑफ आवर है, हमारी जरूरत है। साथियों, देश में अच्छी दवाइयां, सुलभ सस्ती दवाइयों का भी उपलब्ध करवाना हमारे लिए उतना ही महत्वपूर्ण है। मानसिक स्वास्थ्य देखभाल सुविधा प्रदान करने के लिए भारत सरकार ने देश में राष्ट्रीय मानसिक स्वास्थ्य कार्यक्रम, नेशनल मेंटल हेल्थ प्रोग्राम NMHP लागू किया है। NMHP के जिला मानसिक स्वास्थ्य कार्यक्रम में DMHP जो डिस्ट्रिक्ट लेवल पे इस घटक को हम आज 738 जिलों में ये कार्यान्वयन करने के लिए हमने मंजूरी भी दी है कि जिला लेवल, जैसे हम PHC का CHC का सोचते हैं तो जिला लेवल से ही इसे एक बॉडी मॉनिटर करे, जिसके लिए हमें NHM के माध्यम से सभी राज्यों को, सभी UTs को सहायता प्रदान की जाती है, तो बजट भी प्रोवाइड करते हैं। ये सवाल हमेशा सर पार्लियामेंट में आता है कि सरकार क्या मानसिक स्वास्थ्य को लेके गंभीर है, चिंतित है, क्या उपलब्धियां करवा रही है? तो हम बोलते हाँ, सरकार ने पॉलिसी भी लाई है, काम भी किया है और डिस्ट्रिक्ट लेवल पर हमारे जो अस्पताल है उनमें हम साइकेट्रिस्ट हो, दवाइयां हो, ये सभी देने को हम लोग प्राथमिकता देते हैं। और इस माध्यम से, इस कॉन्फ्रेंस के माध्यम से मैं यही अवगत कराना चाहती हूं कि ये सुविधा है, आपको उसे पहुंचाना है। अगर कोई नीडी है, अगर कोई जरूरतमंद है तो आपको उसको सही दिशा में सहयोग भी करना है। CHC, हमारी CHC है, प्राइमरी हेल्थ केयर है, तो DMHP द्वारा ये सुविधाओं में उस पेशेंट को उसकी दवाई, उसकी आउटरीच सेवाएं, उसका ट्रीटमेंट, ये सभी शामिल है। और यही नहीं तो टर्शरी केयर तक, टर्शरी लेवल की सुविधा प्रदान करने के लिए हमने 25 ऐसे केंद्र स्वीकृत किए हैं जो उत्कृष्ट केंद्र है, जिसमें हम काम कर रहे हैं। इसके अलावा सरकार ने मानसिक स्वास्थ्य विशिष्टताओं में 47 विभागों में PG के कोर्सेज द्वारा PG को शुरू करवाया है, जिससे कि ये स्ट्रक्चरल भी मजबूत होगा और उसका लाभ विद्यार्थियों को पढ़ाई के साथ पेशेंट को भी होगा। और ऐसे 19 मेडिकल कॉलेजों में ये शुरू करवाया है और कुछ इंस्टीट्यूशंस में। हमारे 22 एम्स जो कुछ बने हैं, कुछ प्रोसेस में है, उस 22 एम्स में भी मानसिक स्वास्थ्य सेवाओं का प्रावधान किया गया है। एक अलग डिपार्टमेंट उसको रिसर्च बेस हो या टर्शरी केयर बेस हो, उस पे काम करेगा। इसके अलावा हमने आयुष्मान भारत, प्रधानमंत्री जन आरोग्य योजना जैसी बड़ी योजना है, उस पे भी खुशी है कि आदरणीय प्रधानमंत्री जी के नेतृत्व में और आदरणीय स्वास्थ्य मंत्री डॉक्टर मनसुख मांडविया जी के मार्गदर्शन में हमने 2022 में नेशनल टेलीमेंटल हेल्थ लॉन्च किया। प्रधानमंत्री जी का कहना है कि हमें टेक्नोलॉजी का उपयोग करना चाहिए। जहां हम नहीं पहुंचते हैं वहां टेक्नोलॉजी के माध्यम से क्या हम जुड़ पाएंगे? तो हम जुड़ पाएंगे। ये कोरोना ने हमें सिखाया है। कोरोना ने हमें इतने सबक सिखाए, उसमें से एक है ये टेलीमेंटल कंसल्टेशन। और आज हम जब रिव्यू लेते हैं तो देश में, पूरे देश में 42 टेलीमानस सेल स्थापित किए गए हैं। और टेलीमानसिक स्वास्थ्य सेवाएं शुरू करने के बाद हमारी जो हेल्पलाइन नंबर है, उस हेल्पलाइन पे अब तक 2 लाख से अधिक कॉल प्राप्त हुए और उसका समाधान करने के लिए हमारी टीम ने काम किया। ये उपलब्धि है। किसी ने सोचा नहीं था कि डिजिटली भी हम जुड़ सकते हैं, किसी को मेंटली हम सपोर्ट करते हैं और उन लोगों से भी हम बात करते हैं। अगर सर आपके भी कभी टीम जाएंगी तो ये टीम से जरूर मिलना, उनके अलग अनुभव है। बहुत छोटी बातें होती हैं, लेकिन हम बहुत ही गलत अलग तरीके से निर्णय पे आ जाते हैं। ये भी हमें सोचना है कि किसी को काउंसलिंग करते समय किस तरीके का ट्रेनिंग देना होता है। तो ये हमारी हेल्पलाइन के जो 2 लाख हमने मदद की है, नंबर पे कॉल आए हैं, तो ये भी एक हमारी उपलब्धि रही है कि कोरोना के बाद ये काम भी अच्छे से शुरू हुआ है। साथियों, जहां तक जैसे मैंने पहले ही कहा कि बच्चों के लिए, बच्चों का मानसिक स्वास्थ्य, इसके लिए भी हमारे मंत्रालय के साथ साथ, हेल्थ डिपार्टमेंट के साथ साथ अन्य मंत्रालय भी काम कर रहे हैं, जिसमें खास करके मैं कहूंगी कि शिक्षा मंत्रालय ने मनोदर्पण नाम से एक सक्रिय पहल शुरू की है। मनोदर्पण, जिसमें छात्रा, शिक्षक और परिवारों को मानसिक स्वास्थ्य और भावनात्मक कल्याण के लिए मनोवैज्ञानिक सहायता प्रदान करने के लिए गतिविधियों की एक विस्तृत श्रृंखला शामिल की है। मनोदर्पण पहल के तहत शिक्षा मंत्रालय की वेबसाइट पर एक वेब पेज बनाया गया है, जिसपे परिवारों के लिए मनोसामाजिक समर्थन के लिए क्या करें, क्या नहीं करें, इसको इस वेब पेज पर अपलोड किया है। मनोदर्पण के तत्वावधान में बच्चों के मानसिक स्वास्थ्य और मानसिक कल्याण पर नियमित वेबिनार भी आयोजित किए जाते हैं। जो भी यहाँ पे पेरेंट्स होंगे या फिर हमारे मित्र परिवार, हमारे रिलेटिव्स, उसमें ये बातें हमें बोलनी चाहिए, क्योंकि ये ऐसे वेबिनार में हमने सहभागिता लेना आवश्यक है। तो ये वेबिनार भी आयोजित किए जाते हैं। और इसी प्रकार हमारी मिनिस्ट्री ऑफ सोशल जस्टिस एंड एम्पावरमेंट के तहत हमारे दिव्यांग भाईजनों के लिए ये विभाग भी इसी दृष्टि से, क्योंकि वहां पे उनकी मनोभावना से जुड़े अनेक सवाल होते हैं। उनको यह फील होता है कि मेरे लिए क्या यह सुविधा नहीं है। तो ये मंत्रालय भी उस दिशा में काम कर रहा है कि उन्हें भी सहायता मिले, सहयोग मिले, ट्रीटमेंट मिले, जो भी सुविधाएं हैं उनके लिए वो देने के लिए ये काम करे। साथियों, ये बड़े दुख का विषय है कि मानसिक स्वास्थ्य समस्याओं वाले व्यक्तियों को अभी भी अधिकांश देशों में मानव अधिकारों का महत्वपूर्ण दुरुपयोग झेलना पड़ता है। इसे भी हम काम करें। देखभाल की आवश्यकता वाले लोगों और देखभाल तक पहुंच रखने वाले लोगों के बीच भी अभी भी बड़ा अंतर है। शिक्षा एवं रोजगार के दौरान भी मानसिक बीमारी को हीनता से नहीं लिया जाता है। ऐसी अनेक बातें हैं जो छोटी हो सकती है, लेकिन बहुत गौर करने वाली बातें हैं, जिसके कारण एक मेंटल स्ट्रेस के लिए शायद हम सोचते नहीं है, लेकिन वो स्ट्रेस क्रिएट होता है। तो ये छोटी छोटी बातें हैं जिस पे हमें काम करना आवश्यक है। इस कॉन्फ्रेंस के माध्यम से वो चर्चा मैं अपेक्षा रखती हूँ कि वो जरूर होगी। और यही समय है, दिस इज द राइट टाइम, कि जब हम जागरूकता को बढ़ावा देने पर ध्यान केंद्रित कर सकते हैं कि मानसिक स्वास्थ्य शारीरिक स्वास्थ्य जितना ही महत्वपूर्ण है। और इसके लिए हमें जस्टिस सर ने बिल्कुल सही कहा कि हमेशा हमें दवाओं के और एडमिट रहने की आवश्यकता नहीं है, संस्थानों में रहने की आवश्यकता नहीं है, लेकिन जिस तरीके से आज काम हो रहा है उसे भी गौर करना है। इस समय पेशे और सेवाओं के रूप में मनोचिकित्सा और मनोवैज्ञानिक परामर्श हमारे उभर रहे हैं, और हमारा मानना है कि मिलकर हम इसका मुकाबला भी कर सकते हैं। एनएचआरसी अपने स्थापना काल से ही वार्षिक पत्रिका मानव अधिकार नई दिशाएं इसका संपादन कर रही है, और जो एक बहुत ही सराहनीय प्रयास है। मैं उसका अभिनंदन करती हूं कि पत्रिका के माध्यम से देश में मानव अधिकारों का संवर्धन हो और संरक्षण, इस दिशा में संवेदनशील प्रयास किए जा रहे हैं, जिसमें इस पत्रिका का भी महत्वपूर्ण योगदान है। और जाते जाते मैं यही कहूंगी कि हमें समस्याओं का समाधान ढूंढते ढूंढते ये परिस्थितियां कैसे संभालनी है। ये सब प्रॉब्लम्स, ये सब इट्स अ पार्ट ऑफ लाइफ। मैं तो मानती हूं इट्स अ पार्ट ऑफ लाइफ, बट हाउ टू टैकल दिस प्रॉब्लम इज अ आर्ट ऑफ लाइफ। ये आर्ट आप लोग सीखोगे तो शायद ये समस्या भी कम आएगी। और इसके लिए आदरणीय प्रधानमंत्री जी ने अंतर्राष्ट्रीय योगा डे को कितनी अच्छी तरह से पूरे विश्व में फैलाया है। आज 150 देश में ज्यादा अगर योगा सेशन चल रहे हैं, मेडिटेशन हो रहे हैं, इसकी वैल्यू अलग है। हमारी संस्कृति हमें सिखा रही थी, सिखा रही है और सिखाएगी, और इसको हमें आगे लेके जाना है। हम अगर योगा मेडिटेशन के रोज के हम प्रयास अच्छे करेंगे तो शायद मेंटल स्ट्रेस को टैकल करना भारतीय लोग सबसे अच्छा, सबसे ज्यादा विश्व में संभालते हैं, यह मैसेज जाएगा। और इसे बढ़ावा देने की भी आवश्यकता है। हमारी आयुष मंत्रालय आज उस दृष्टि से उस दिशा में काम भी कर रही है। सर, कुछ योगा सेशंस डेली हमारे स्कूलों में भी लिए जा रहे हैं। एक बार मैं बहुत ही इंटीरियर में नॉर्थ ईस्ट में प्रवास कर रही थी, वहां पे हेल्थ एंड वेलनेस सेंटर था। तो जाते जाते मैंने गाड़ी रोकी और मैंने कहा बस 2 मिनट के लिए मैं देख के आऊं। वहां पे एकदम छोटे से शेड में कुछ महिलाएं योगा सेशन कर रही थी, और वो सारी सीनियर सिटीजन्स थी, कुछ 70, 75, 80, 85 तक की थी। तो मुझे इतना अचरज हुआ कि वो वहां पे रोज योगा करने आते। तो मैंने पूछा आप रोज करते हैं? तो बोले हाँ। और उन्होंने कहा कि पहले हम यहाँ के बैठते थे और जस्ट चिट चैट गपशप लड़ाते थे और चले जाते थे घर पे, लेकिन ये प्रधानमंत्री जी ने शुरू किया, ये करो, तो हम लोग करने लग गए। तो अभी अच्छा रिजल्ट मिल गया कि जो पेन होते थे, जो दुख होता था चलने में, जॉइंट पेन, तो वो नहीं हो रहे। ये रिजल्ट है। और उन्होंने उसको अभी एक गांव के समक्ष एक उदाहरण प्रस्तुत किया है कि हम कर रहे हैं तो आप युवाओं ने भी करना है। और वो सारी महिलाएं बड़ी खुशी से वो योगा सेशन चला रही थी, कर रही थी। कोई ट्रेनर नहीं था। पहले 10 दिन ट्रेनर आया, सिखाया, आसन सिखाए, उसके बाद वो खुद ही कर रही थी। तो मुझे लगता है अगर गांव गांव में ये सुविधा पहुंच रही है, हमारा प्रयास पहुंच रहा है, तो जरूर हम इसमें भी कामयाब होंगे कि भारत एक दिशा दिखाएगा कि मेंटल स्ट्रेस को कम कैसे करना है। और ये ताकत भारत में ही है। ये विश्वास आदरणीय प्रधानमंत्री जी ने दिलाया है। हम जब हमारी वन अर्थ, वन फैमिली, वन फ्यूचर को देखते हैं, वसुदैव कुटुंबकम की भाषा को संकल्पना को परिभाषित करते हैं, मुझे लगता है कि हम मेंटल स्ट्रेस, मेंटल हेल्थ को भी उतनी ही अच्छी तरह से समझेंगे, उस पे काम करेंगे। और मुझे उम्मीद है कि हम सब मिलकर देश में जागरूकता के साथ साथ देखभाल के मानक को उच्च स्तर तक बढ़ा सकते हैं। और जिसके लोग हकदार हैं, उनका अधिकार है, और लोगों के उनके जीवन में मानसिक स्वास्थ्य के इस महत्व को समझने में हम मदद कर सकते हैं। फिर एक बार सभी को मैं बहुत धन्यवाद देती हूँ और वही पंक्तियां दोहराती हूँ कि सर्वे भवन्तु सुखिनः और सर्वे सन्तु निरामयाः। सर्वे भवन्तु सुखिनः मतलब सभी सुखी हो, और सर्वे सन्तु निरामयाः है कि सब रोग मुक्त रहो। धन्यवाद। जय हिंद, जय भारत।
Thank you, ma'am, for your insightful thoughts on the issues of mental health care and the steps being taken by the government in this regard. May I now request Mr. Bharat Lal, Secretary General NHRC, to please present the mementos to the dignitaries on the dais. First to the Honorable Minister. Thank you. May I request Mr. Lal to present a memento to the Honorable Chairperson. To the Honorable Members, Dr. D.M. Mulle, a memento. Thank you, sir. To Mr. Rajiv Jain, Honorable Member NHRC. Thank you, sir. To our former member, Mr. Justice M.M. Kumar. Thank you, sir. Thank you. Ladies and gentlemen, there is always a person behind the planning, coordination, and execution of all such events. And in this context, I would mention the name of Mr. Devendra Kumar Nim, Joint Secretary NHRC, and request him to deliver the vote of thanks.
Thank you, Jamini ji. Honorable Minister of State for Health and Family Welfare, Dr. Bharti Parveen Pawar ji. Honorable Chairperson, National Human Rights Commission, Justice Sri Arun Mishra ji. Honorable Members of NHRC, Dr. D.M. Mule ji and Sri Rajiv Jain ji. Honorable Secretary General NHRC, Sri Bharat Lal ji. Honorable Justice, former member of NHRC, Sri M.M. Kumar ji. Honorable Chairperson and members of State Human Rights Commission who are present here. Respected Additional Chief Secretary, Health Secretaries of States, respected mental health institutions, directors, HOD, professors of all the mental health institutions and private health institutions also. For example, Kadabam, Mr. Sandesh Kadabam from Kadabam Hospital, Bengaluru, and doctors and head HOD from Gangaram Hospital, from the Psychiatry Department, all the NGOs who are working in the mental health sector, all the CSOs and individuals working in the mental health sector, ladies and gentlemen, very good morning to all. I feel privileged and honored to propose a vote of thanks for this important conference on mental health, and which is named as Mental Health Beyond Institutions. First and foremost, on behalf of National Human Rights Commission and all the members from the mental health fraternity present here, and state governments and SHRC, I express my sincere gratitude and thanks to Honorable Minister of State for Health and Family Welfare, Dr. Bharti Parveen Pawar ji, for her gracious presence and also inaugurating the conference. I also thank her and express my gratitude on behalf of NHRC to release the book and report on the mental health. I express my sincere thanks and gratitude to Sri Justice Arun Mishra ji, Honorable Chairperson, though he always says that he is the host, why you thank him, but I would like to thank for the guiding support, always motivation us, and from the speech, his speech, you can understand how concerned he is about the human rights and rights of others. For example, I will, though वो मुझको डांट सकते हैं बाद में कि क्या आपने क्या कहा, लेकिन आपको एक एग्जांपल आज का ही देना चाहूँगा. That's why I'm thanking him. Justice M.M. Kumar is the former honorable member of NHRC, and because he has contributed in the book on mental health, he always, I think 8-10 times he directed me to invite Justice M.M. Kumar. Because he has contributed in the book. I forgot 2-3 times, but he always daily he was asking me whether you have invited, you have spoken to Justice M.M. Kumar, though he had already spoken himself with Justice M.M. Kumar, but he reminded me again and again that he should be invited for the conference, for the inaugural session of the conference, and you can understand the concern of Justice Arun Mishra sir. Honorable Chairperson, I think I would request all for the great applause because I express my sincere thanks and gratitude to honorable members of the National Human Rights Commission, Justice Dr. D.M. Mule and Sri Rajiv Jain ji for motivating us, for guiding us to successfully conducting this conference. I express my sincere thanks and gratitude to Secretary General Sri Bharat Lal ji, for motivating us and always guiding us to improve the quality of everything in office, in our official work. I express my sincere thanks to all the directors of mental health institutions who have come here on our request, and they will be participating all the 4 technical sessions, and we are confident that this conference will bring about some special changes and special outcome of this conference on the mental health sector. I would be failing in my duty if I don't thank media, print media and electronic media for coverage of this event. I also would like to thank all my colleagues, Shri Manoj Yadav, Director General, Registrar Law, Shri Sudhir De, my colleague, Joint Secretary Madam Anita Sinha, all the officers and staff of the NHRC, and all young research consultants of NHRC, specifically who have contributed in printing of book, printing of report, and conducting of this conference. I would like to name three, 4 young consultants: Akanksha Sharma, Architi Batra, Dimpi Laskar, Sajid Mohammed, and all. Thank you very much. Thank you all.
Thank you, sir. Ladies and gentlemen, we will now take a break for tea and begin with the discussions in the first technical session after 25 minutes.